Good afternoon, everyone. It's good to see you again today here on the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nation. I want to start my weekly media availability by saying I'm joined by Dr. Henry and Minister Adrian Dix because there's a particular issue we want to talk about today, and then of course I'll be available for any other questions on any subject that you may have. But I want to start by saying British Columbians have been successful with COVID-19, in part because communities have worked hard together. We want to make sure that we keep people safe, and one of the best ways to do that is to have strong contact tracing. It's especially important, of course, when we have an outbreak. Contact tracing involves following up with people who have tested positive for COVID-19, making sure that we know all of the people they've come in contact with when they could have been infectious. Although we do support the federal government's work developing a COVID alert app for smartphones, the app can't tell you everything. Nothing replaces person-to-person contact. Public health teams typically have staff who work on contact tracing for communicable diseases. But during a pandemic, more resources are required. That is why I'm pleased to announce today that the province will be hiring 500 more healthcare professionals to increase contact tracing across British Columbia. Some of these positions will help support public health in communities, as well as, of course, preparing for the fall immunization plan, which we'll be announcing later this month. These positions will be temporary and will be recruited by the Provincial Health Services Authority. We expect many will be retired nurses and other healthcare professionals, as well as recent graduates. Our plan will allow health authorities to increase the number of public health workers focused on COVID-19. And it will also ensure that we have teams that we can deploy across the province as required. These positions will start in September, and this plan will help us deal with community transmission now and into the fall. And I'll ask Dr. Henry to say a few words on the content of today's announcement, and then I'll be happy to take questions on any other subject.
Thank you very much. So contact tracing and case management are terms that have really come to light for many people in BC only since this pandemic started. But as I have said a number of times, this is bread and butter work for public health. It's how we ensure that when somebody's infected with a communicable disease, something that can be transmitted between people, that we do everything we can to prevent that transmission and prevent others from getting sick. So this is something that we do quite commonly for diseases like measles or tuberculosis and other infections that we have in the province. And for COVID-19, it is exceedingly important. We know that because we don't have a treatment, we don't have a way of stopping somebody from getting sick if they've been exposed, that the way that we control this virus in our communities is by making sure that anybody who's been exposed is in isolation and monitoring their symptoms and making sure they're staying away from others so if and when they get sick, they're not passing it on. And the work of doing that is the work that we do in public health with our contact tracing teams. And across the province, each of the health authorities has developed teams that are experts in doing this. And so every time we have a positive case of COVID-19, they're followed up individually to find out exactly who they were with, where they went, the movements that we do every day, and we're very skilled at being able to go through those things with people in a very confidential way and making sure that we know those people who might be at risk. There's often different levels of risk, and we've put out alerts, for example, where people might have just been exposed for a very short period of time, and we ask them to monitor themselves carefully for symptoms and give them a number so they know what to do if they start to feel ill, and so they can get tested rapidly. For others, they may have had very close contact, and that's often people that we spend time with in indoor spaces, our family, our friends, maybe in a workplace where we've had settings or where we've had transmission. It may be in a healthcare setting. And for those people, we require them to stay home for 14 days. That's the incubation period, the period where they might become sick. And this is how we break those chains of transmission. And this has been the work that we've been doing since our first cases in January here in BC. And as the Premier has indicated, it's taken a lot of work. And many of the people who are doing this on a day-to-day basis across public health do other very important public health work as well. Everything from our immunization programs to restaurant inspections. And so this allows us now to get more people trained up to do this really important work as we continue through the progression of our pandemic here in BC, and make sure we're prepared if there's a surge of cases in the coming months. And so the new people will be joining the teams that we have, and will be supporting as surge capacity with our public health teams across the province. I will also note that the work that we do in trying to support people to make sure that they can isolate appropriately, that they have what they need to be able to stay home, to be able to stop these chains of transmission, is incredibly important work, and we are committed to doing that to make sure that we bend our curve and keep it low here in BC, and we reduce the risks in our communities so that we can continue to increase our economic, to make sure that our surgeries are starting again. It's the key part that we need to do to keep going for the next few months to maybe even years until we have an effective vaccine for this virus. Finally, just to note that when we do ask people to self-isolate because they have been exposed, this is a public health order. So that means you are required to do that. And most people, when we give them the means to do that and we support them in doing it, have been very good about that. And we will continue to support people across the province as we go through our pandemic. Thank you.
Okay.
Reporters on the line, please press *1 to get in the queue. If you have already press it again, just so we see your name. And another reminder, you will be permitted one question and one follow-up. Our first question today is from Tanya Fletcher.
This first question is for Dr. Henry. Given what you just announced with contact tracing, I'm hoping we can take kind of a bird's eye view look at this, and how close are we to that threshold of transmission getting out of control? You know, you've praised the work of contact tracers up until now, but you've also just talked about what a huge effort it is. So at what point is buckling back down on restrictions the answer if this contact tracing isn't enough?
Yeah, so we've said this all along, and the contact tracing is enough. We've seen, as you know, over the last few weeks, a gradual increase in numbers of people who have tested positive, and we've been reporting out on the contacts as well, and we're now up around 1,700 people who have been in contact and that we're following up on a daily basis. So we have the resources to do that. We've presented some data as well earlier on that looked at the numbers of contacts per case, and it had started quite high and then it went quite low, and now it's creeping up again, and that is concerning. Right now we are holding our own. We're able to contact 98% of the people who are close contacts of our cases here in BC. We're not seeing a lot of unlinked cases. And yes, this is the work that the teams are doing across the province. It's, it's hard work, and a lot of us are working long hours doing this, and I think the kudos go out to the teams across the province. So this is a welcome surge capacity, and will also allow some of the other important work that has been put aside necessarily to focus on the pandemic to be picked up again. But I really think it's a testament to the teams that we have here in public health in BC that we've been able to manage this, and we will continue to manage this.
Tanya, do you have a follow-up?
The Premier, yes, please, for the Premier, and just a warning to Minister Dix, I would ask for a response in French as well. Despite the urging of public health officials, we are still seeing a surge in cases among young people, and I know this has been the theme all summer. We've asked you this before, but even after additional restrictions were put in place on venues like bars, beyond a scolding, I guess, from you as Premier, what is the next tactic to get those cases more under control, especially with schools opening?
Well, thank you for the question. And Dr. Henry and Minister Dix and I have been talking about that very thing over the past number of days. Obviously, this is a welcome infusion of healthcare professionals on the contact tracing side, so that can relieve the pressure, as Dr. Henry said, on the extraordinary work that's been done to this point in time. But as we've seen over the past number of weeks, the good behavior, the common sense of British Columbians is not consistent across the board. Although the vast majority of British Columbians are listening carefully to public health directives, they're acting appropriately. There are incidences where that's not the case. If it's a commercial establishment, of course, we've taken actions through public health, through other enforcement measures. But when it comes to things like private parties, people flaunting the restriction on the number of faces in the smaller spaces. And so we're going to be looking hard at enforcement when it comes to situations like that. We don't want to do that. We prefer the good judgment of British Columbians, but those tools are available to us, and they're escalating, starting with warnings, of course, and then getting into more severe penalties. But we have been successful without taking a punitive approach to this pandemic, and we want to keep it that way. But if people continue to work around or try and disregard the rules that the rest of British Columbians are following, then we will, of course, take action. With respect to schools, I'm sure we'll have other questions on that, so I'll ask Minister Dix to respond in French and go from there.
Oui, merci beaucoup, Premier ministre. Je pense que c'est important, c'est essentiel, en fait, de convaincre, d'avoir des gens agis comme il faut pendant une période de pandémie. Mais il est évident que des ordres du Dr. Henry, les ordres des régies de santé, des officiers des régies de santé sont essentiels. Et il faut les suivre, les ordres. Il n'y en a pas beaucoup, mais ils sont essentiels et importants. Et nous avons l'intention de continuer à convaincre, mais aussi d'assurer, d'utiliser les moyens qu'on a, d'assurer que ces ordres sont suivis partout dans la province.
And our next question today comes from Richard Zisman.
This is for Dr. Henry. We've seen on Heather Street in Vancouver a line down the street for people getting COVID-19 tests. Are there concerns around the volume of people that are looking for testing? And what do you do to explain why we're seeing this significant volume of people going in for tests now?
Yeah, I'm not concerned. Our turnaround times is something we watch very carefully, and they have gone up in a couple of places. Turnaround time is the time from when a swab is taken till the test result comes back. And it has varied a little bit, particularly when we had an increase in the interior and we had some equipment problems. But for the most part, on average, and this is posted on the BC CDC website, it's 24-hour or less turnaround time. So that is a measure that we're watching very carefully. We have capacity for testing. What you're seeing in Vancouver right now is reflected in the numbers that we've seen in the last little while, where there's been exposure events where larger numbers of people have been exposed, and public health has been advising people to go and get tested. So there's a very low threshold, as you know right now, for anybody with any symptom, particularly if you've been in one of these places where there's been exposures, known exposures. So we are seeing quite a lot of people going for testing. We've seen the numbers increase in people being tested, and we've seen an increase in the percent positivity in the younger age groups. So that tells us it is the people that we've been trying to reach that have been directed to go for testing. So that to me tells us that it's working.
Do you have a follow-up, Richard?
I do. For Premier Horgan, what do you say to parents who are trying to figure out what the fall looks like in terms of childcare, in terms of their own decision to send kids back to school? Now they've been told that school will be delayed by a few days, although not in every district. So what do you say? And then also trying to balance if they're going to send their kids to before and after school care. So what do you say to those parents who are grappling with tough decisions on schools and also trying to figure out with very limited options what to do around childcare?
Well, thank you for the question, and it is, of course, very topical here as we come to the middle of August and we start looking to September and Labor Day and the beginning of the school year. I remember vividly taking my kids to their first day at Happy Valley Elementary in Langford. They were anxious. Who was going to be in their classroom? Who was their teacher going to be? My spouse Ellie and I were both anxious about their well-being outside of a pandemic. So I fully understand how parents and families are concerned about the circumstances we find ourselves in. But I also know that the Minister of Education and a whole host of educators and other professionals in the education sector with public health officials have been working diligently to ensure that we have a safe and effective restart of our K-12 system, which includes before school and after school care for young ones. And we've had a collaboration between the minister responsible for childcare as well as Ministry of Education officials, trustees, and school boards across the province. One size does not fit all. We all understand that. But we also understand that it's fundamental to reestablishing a normalcy within our communities that we have safe places for our kids to be so they can learn and grow and socialize and do all the wonderful things that children do in their elementary school years. And then the exciting things about becoming adults and getting into high school and then moving on to other endeavors within the community. These are fundamental parts of people's lives, and we want to make sure we manage it as carefully as we can for their well-being, but also ensure that we have these options available for people. I know there's going to be those that are concerned. We're working every day diligently to try and ease those concerns and make it as safe as we possibly can. That's our objective, that's our goal, and I think parents understand that, educators understand that, and the kids, of course, they just want to get back to school.
Our next question is from Rob Shaw.
For Dr. Henry, I think it was a few months ago we had a technical briefing that talked about how quickly contact tracing had to be done within a certain timeline in order to keep epidemic control from growing. Are we meeting those timelines and percentages? And is the extra contact tracers today a reflection of needing more people, that we're falling behind in some way, or sort of update us on those figures?
Yeah, so I will actually be presenting some of that again tomorrow. But you're right. We looked at a couple of things: completeness of contact tracing and the time it takes to find people. So those are the two things we're focusing on. And that's why we put in some of the measures like requiring people to leave contact information if they're at a restaurant or going into a bar or pub, so that we can find people more efficiently. And this is one of the things where the CAN app may help us as well. But yes, we are keeping up, and as we've had actually a bit of a lull over the last few weeks, though as we know, increasing recently. We absolutely have been keeping up. This has been on the plans. We've been talking about how do we best prepare for a surge, also knowing that the respiratory season starts in the fall and that we need those essential parts of our community like schools to be going again. So it's all a matter of the balance that we've been talking about all along, of being able to open up our economy, getting people back to work, getting surgery started again, getting our healthcare system working, getting visits in long-term care home, getting schools started. And we need to make sure that we can continue to keep up on it. But right now, yes, we're working hard, but we're holding on.
Do you have a follow-up, Rob?
Yeah, thanks. For Minister Dix, could you comment on the sale of the St. Paul's Hospital location to Concord Pacific for $1 billion, and sort of update us on what that means for the new St. Paul's Hospital project, where its budget and timeline is, and what the situation looks like right now?
The new St. Paul's is on track, and the goal, as you know from the announcement, I think, is for it to be ready to welcome patients in 2026. The arrangement with Providence Healthcare is that they would make a contribution and we would make a contribution, and the proceeds of the sale by Providence Healthcare today go to their share of that contribution. But the project, after decades of delay, is on track. This was a project that was announced in 2002, then 2004, then 2006, then 2008, then 2011, then 2016, without going anywhere. And so what we've tried to do is systematically, step by step, do what's necessary, which is to build a new St. Paul's, the St. Paul's that Vancouver needs in the 21st century with our partners at Providence Healthcare, and today is a step on Providence's side to do their share of the work that we've done together. And I'm very proud of Providence Healthcare and as partners, Vancouver Coastal Health, of course. The project is on track and moving forward, and that's good news for everybody in Vancouver, but also everyone in BC who uses St. Paul's.
Our next question is from Penny Davlos.
Hi there. Thanks for taking my question. Our COVID numbers are going up. The approach till now has been, asking people nicely to keep their distance, good hygiene, recommending masks, and I recognize that strategy. But is it time for tougher, clearer messaging as well as mandatory masks for all indoor spaces, excluding eateries, of course, instead of the patchwork approach we're seeing where each business or TransLink or whoever has their own policy? Because I think the problem is mask-wearing behavior isn't being normalized or made routine the way that things stand right now.
Good question, and certainly when I can't physical distance, particularly when I'm indoors, I wear a mask. I recommend that to the bells that are ringing. I think there's one more. No, there's not. So I recommend that. Dr. Henry can fill in any of the gaps here, but it's our view that we don't want people to believe that masks will be an invincibility shield for them. It is one of the tools of many tools that Dr. Henry's laid out for the public. Physical distancing, keeping your hands clean, making sure if you're sick, for goodness sakes, do not go out. These are fundamental issues, and if we stay fast to those issues, we will be fine. Masks are a component part of that. I'm pleased to see public transportation companies like TransLink and BC Transit are encouraging and in fact directing their patrons to wear masks. I think that's appropriate. Other issues around how masks should be used, I think, are better answered by the Public Health Authority, who's right here, so I'll pass it to her.
Sure, and thank you for that. I actually do think masks are becoming normalized in many communities, and I certainly see it myself. And as we progress and open up more, it's going to become important. I don't believe, and I've said this many times, that having a public mandate is the way to go in terms of masks, because it may indicate, as we were talking about, that people may think that this is a shield. That means you don't have to do the other things. We know that physical distancing works. We know that keeping your contacts small works. We know that in settings like schools that are very controlled, we can put in place layers of measures that protect us. And we've said from the very beginning, personal protective equipment like masks in the community are the last line of defense, and they should be worn when you can't maintain those physical distances. But we also need to remember that we need to be inclusive. There are reasons why people cannot wear masks, and we need to ensure that they can get the services and the care they need as well. I will also say that we are now, we are looking at where these transmission events are happening as part of our case management, contact tracing, outbreak management across the province. And where we're seeing transmission are events and places where people would not wear masks, so private parties, for example. Where they are being mandated in some of the businesses where we've had outbreaks, it's because other things weren't being done as well. So the mask by itself is not something that's going to stop all transmission from happening, but it certainly is one of those layers in some situations.
And do you have a follow-up, Penny?
I do, yes, thanks. Point Roberts residents would like to be able to cross into Canada and then right back out through Peace Arch into Washington State to stock up on supplies or visit family, etc. And I'm just wondering, Premier, would you support an exemption that would allow them to travel through without the quarantine period? And if so, how would you monitor them?
Well, you've answered the question, Penny, I think. How would we monitor that? We had a challenge with what was characterized as the Alaska loophole, and we worked with the federal government to ensure that our neighbors could transit through British Columbia from the United States to Alaska if that was their final destination. But we wanted to make sure they did that with haste, and they didn't linger through our public parks, through our communities. And we believe that working with the federal government, we've come up with a positive response there. With respect to Point Roberts, this is a very sticky issue and one that I've discussed with the federal government, and I'll leave it in their hands to manage. The borders are not our responsibility, although British Columbians don't like to hear people pointing in different directions when it comes to jurisdiction. We're all in this together, and we have had success, all orders of government, Indigenous communities as well, working together to address the challenges that we face. This is another one, and it's in the file of the Deputy Premier, or Deputy Prime Minister, I should say, and she'll keep me updated, and when I get any information that'll be helpful, I'll pass it on to you.
Our next question is from Bob Mackin.
Hello, Premier. We're coming to the end of the legislative session, and there still is speculation of a fall election. And you've talked a lot about, quoting Dr. Henry, being kind and calm. Elections are not calm, and they often get nasty. And why would the NDP consider an early election this fall when it's not really needed, and when it would put the NDP's interests perhaps ahead of the public's interest, above British Columbia's interests, especially at a time of pandemic?
Thanks for the question, Bob. What I have been focusing on every day is making sure that we're providing the services British Columbians need, whether it was within the pandemic or outside of the pandemic. We have a couple days left in the legislative session. The Minister of Finance is finishing up her budget. I begin my debate tomorrow for Thursday and Friday. And when that's concluded, we'll continue to work on the restart plan, the recovery plan that we have been working on all summer long, taking input from businesses, from not-for-profits, from communities, labor organizations, and individuals. A large consultation to make sure the now $2.5 billion that we have earmarked to put into transit, to put into ferries, to put into businesses and not-for-profits and community organizations is well deployed. That's my focus. Having said that, it's not a surprise to anyone, certainly not to you, that we are a minority government, and in that context, every day is potentially your last day. And quite frankly, that's been motivation for me over the past 3 years to focus on the things that matter to British Columbians. So I'm going to stay on that track as long as I can.
Do you have a follow-up, Bob?
Yes, I do. To use a sports analogy, an election would be more like what's going on in Major League Baseball right now than what's going on with the NHL bubble. It would require travel around the province. It would require gathering of people. And no matter how solid Dr. Henry's plan and advice might be to Elections BC, it would still put people in jeopardy. Wouldn't you want to talk to the other parties and come to an agreement that maybe now is not the time, and maybe to stick to the original schedule, the end of the mandate next year?
Well, again, you also, if elections are cantankerous in any jurisdiction, spend 5 minutes in the BC legislature, Bob. I know you're in town. You'll see with your own eyes that it's not love and tranquility during question period. It's hostility and rash accusations and responses. That's politics. That I'll leave for another day. What I focus on as the leader of the government is the bells. What I focus on every day is trying to make sure that we're getting it right for British Columbians, whether it's on the start of the school year, whether it's making sure that our post-secondary institutions are providing the services that young adults and those who are retraining for the opportunities of the future are ready to go. That's my focus without any doubt, and I'll keep focused on that.
Our next question is from Andrea Wu.
For Minister Dix, related to Tanya's question earlier about the increase in cases in young people. On Monday, you had mentioned that there are efforts underway to target young people with messaging that would include enlisting social media influencers and such. I was hoping you could provide a bit more detail on those efforts, like who we're approaching, how the campaign is being developed, and what considerations go into targeting this younger cohort.
Minister Dix has gone to the legislature. That's what those bells are for. I don't know if Dr. Henry has an answer on that, but I will say that Minister Dix and I have been talking about the importance of making sure that younger demographics are hearing the message. This is a call out to Deadpool right now. Ryan, we need your help up here. Get in touch with us. My number's on the internet. Seth Rogan, another outstanding British Columbian. We need to communicate with people who aren't hearing us. The two of you alone could help us in that regard. There's a host of other options available, and we're working as hard as we can to enlist a number of prominent British Columbians and prominent Canadians to help get that message through to the demographic that clearly isn't hearing our message.
Do you have a follow-up, Andrea?
I do. Dr. Henry, regarding the party in the Vancouver Coastal Health region that resulted in 40-something COVID-19 cases, I was wondering if there were any updates on that. I think the last time that you mentioned it, you said there were 45 or 46 cases.
Yeah, I don't actually have a new number related to that. I know that in my discussions with the people who are doing the work in Vancouver Coastal, it's become clear that there were a series of parties with overlapping social groups. So we're doing what we call social network analysis. It's a technique that helps us identify where people were in contact with people using places and connecting them. It's kind of like a relational database and helps us understand. And that's one of the ways that we know that that most of the people that we are seeing who are testing positive are people that are connected to known exposures or people who were at an event that then went to something else when they were in their infectious period. But I can certainly ask them for numbers directly related to that party. I can say that there's second generation spillover from people who were there, who then went to other places and had other close contacts. And it's across the Lower Mainland. As we know, people move, and they move from the interior, they go up there for a period of time, they come down to the Lower Mainland, and then there's been a movement. People work in one area and live in another and have go to entertainment in other places. So I'll try and get some more detailed numbers for you.
Our next question is from Lisa Yuzda.
Hi there, Speaker. Regarding going back to school and regarding the increased number in cases that we're seeing, is there any thought to pulling back on some of the things that we can do in other aspects of our life to balance out the potential increased cases that we're going to see in schools? And I don't know if that means restricting more on what's happening in bars or things like that so that it will balance out the increase that is potential when kids return to school.
Thanks for the question, and we are trying to find the balance. We have been working for 5 months? Seems like 5,000 months in COVID years. Dr. Henry and I, Minister Dix, and a host of healthcare professionals across the province, as well as other leaders in communities, to try and find that balance of being restrictive enough to get the bend on the curve that we saw earlier, allowing us to go to phase 3 of our restart plan. But as numbers increase, we have to adapt and amend our behavior. That's why today's announcement of 500 more professionals to help with contact tracing is so critically important. It, first of all, relieves those that have been working tirelessly for the past number of months to protect all British Columbians, but it also allows us to expand our education programs. It allows us to make sure that enforcement is in place. And this goes back to, I think it was Penny's question earlier on. We have been relying on people to use their good judgment and common sense, and that we've had positive results because of that. But enforcement is available to us, and if we need to be firmer on these issues, we will. But for now, we believe that the public gets it. As we've seen an increase in numbers, people have started to modify or moderate their behavior in social settings. Stick to the plan, focus on yourself and those around you. Make sure that when you interact with people you don't know in large numbers, you're putting at risk all of your family and all of the connections you have outside of that large group. These are pretty basic elements. We've been repeating it over and over again. Dr. Henry's been very, very diligent in making sure that people clearly understand what we're talking about. But we do need to get the message out to the audience that's not hearing us. And we're looking at other measures to do that. Taking pressure off the contact tracers will allow us to redeploy those resources to get that objective.
And do you have a follow-up, Lisa?
I do. Looking at the contact tracers and the increase, I think this nearly doubles the amount of contact tracers working now. Is this because we don't have the app here? We're hearing a lot about it, people using that contact tracing app, and people have downloaded it here onto their phones, but they're not able to use it yet. Is this balancing out the app not being able to be used, or is the app going to come in conjunction with this increase in contact tracers? I guess that's more for Dr. Henry.
Yeah, well, let me start with it, Lisa, because it was at the federal provincial table where much of the discussion around a safe restart, what role technology would play, and how we could use the person-to-person contact, the gumshoe work, if I could put it that way, the detective work of connecting the dots so that we're protecting people. You can't replace that with technology. The technology is very helpful. We support that. There are some bugs in that tech right now, and the federal government is working with their partners to make sure that the application can be valuable to us, but it will not replace the personalized approach of talking to people and getting answers to questions that may not have been picked up on the app. And Bonnie, I'm sure you want to fill in the gaps there, but are you good with that? Yeah, I'm good with it. We're good with that. Hope that helps.
We have time for one more questioner today, and our final reporter is Rob Buffum.
Oh, hi. Thanks for your time. I think this question probably is for Dr. Henry, and it relates to schools. The success of the province, part of it's been attributed to how much buy-in there's been from people here in terms of doing what it takes to flatten the curve. A recent Insights West poll indicates that about 50% of parents are not comfortable with the back-to-school plan and sending their kids back to school full-time. If that doesn't change, would there be any consideration to modifying that plan as we get into school?
Yeah, that is perhaps a question for the Premier. And I will just say that, my job is to provide the health framework. And I think that some of that, what you're talking about, it reflects the concern that we all have. How is this going to work? And wanting to know the details. And those details are coming.
Thanks for the question, and it is more appropriately put to the policymakers. We, of course, rely very heavily on Dr. Henry and her team to give us the public health framework for the decisions we make, but at the end of the day, the decisions rest with me and my government. Minister Fleming has been working tirelessly with all of the stakeholders, which includes parents, and in some cases with young adults at the secondary level, to try and make sure we're meeting the needs in the community as well as relieving those anxieties that the poll you suggested indicate. I absolutely get that there's anxiety in the community. It's not just about K-12. For many people, it's extremely difficult and filling them with anxiety to go to the grocery store to get their basic needs filled on a weekly basis. We are in a global pandemic. We need to be cautious. We need to be aware. We don't want to be fear mongers, but we want people to recognize that there is no immunity at this point in time. There is no vaccine at this point in time. We have to take the measures that are available to us. Physical distancing, wash your hands regularly, don't go into the broader community if you're ill, and make sure that you keep your contacts as limited as you possibly can. Now that sounds counter to opening up our K-12 system. But we, unlike every other jurisdiction in North America, have the benefit of a month of activity in June that has allowed us to shape what we believe the fall can look like. We have taken a pause to allow educators to get into the schools and prepare for the first 2 days of the school year. But I'm sure that everyone who's listening, everyone who's tuned in right now, anyone who may see these comments down the road, will remember either their children or their own interactions in the first couple of days of school. You talked about how the summer went. You couldn't wait to get back outside. You wanted to play. You wanted to engage and socialize. That's what the first couple of days of school is all about. It's not we're going to have a quiz on Tuesday. It's about how do we get ready and prepare for the year ahead, which includes reading, writing, and arithmetic, but also socialization and learning how to interact with each other. This is an extraordinary time. Our children are going to be extraordinary because of this time that we're living in. I'm excited about it. Am I apprehensive? Sure. But I think that we can go into this with the best of intentions to have the best outcomes if we all work together and keep that flexibility that Minister Fleming demonstrated just this week.
And do you have a follow-up, Rob?
Yeah, Premier, it's on the same topic. I'm just wondering, it sounds like a majority of parents favor some kind of hybrid approach like we saw in the spring with not full-time back in the classroom. I think, as you've noted, there's a bit of adjustment because people went from expecting, maybe younger kids in the school full-time, but not everybody. Given that most parents favor sort of online as well as in classroom, is the plan that's been presented definitely the plan, or is there any option that may get adjusted in the coming months?
Well, we've demonstrated just this week that adjustments will be made as required, and I think that's what parents expect, that's what educators expect, and what we have to focus on is the well-being of everyone in the system, and that's our focus. That's why we take the sound advice we get from Dr. Henry and her team, and we try and implement that with what the reality is in schools right across BC. And as I've said repeatedly, what's needed in Salmon Arm is not the same as what's needed in Saanich or Selmo in the Kootenays. Every school is different, every district is different, and teachers, administrators, trustees, and parents are all going to have to find a way to make it work. And I'm confident that people of goodwill and good intention, knowing the importance of education to our well-being and to our communities, will work as hard as they can to make sure everyone's safe.
Thanks, everyone. That's all the time we have today.
Thanks.